Hello everyone, myself Vivek Devani and my topic is Inhalation Route of Drug Administration. So now let's discuss about the inhalation route of drug administration. But before that, let us discuss about various routes of drug administration because there are many of them. The route of drug administration is decided by the need of the patient and the properties of the drug and which is more favorable for the patient. So now let's discuss in how many parts the route of drug administration is divided. So mainly the route of drug administration is divided into three. First is oral, which is internal. Second is parenteral, and third is topical. Again, the parenteral is divided into four, which are injections, inhalations, transdermal and transmucosals. So the injections are divided into first is transdermal, subcutaneous, intravascular, intravenous, intraperitoneal, intraarterial, intrathecal, intraarticular and intramedullary. Now let's discuss about the transdermal. The transdermals are divided into adhesive units, inductions, iontophoresis and jet injections. And now let's last see about transmucosal. It is divided into sublingual, nasal and rectal. So now let's discuss about our today's main topic, which is inhalation route of drug administration. So it means that volatile liquid and gases are inhaled by inhalation, that is general anesthetics. In addition, some other drugs can also be administered as solid particles. That means that solution of drugs can be atomized and the fine droplets are inhaled in the form of aerosol. For its example, we can take as salbutamol. These inhaled drugs and vapors may act on the pulmonary epithelium and mucous membrane of the respiratory tract. This drug can also be absorbed by this membrane. So now let's discuss some of the advantages and disadvantages of the inhalation route of drug administration. So first, let's see its advantages. The first one is the instantaneous absorption of the drug is possible because of the large surface area of the lungs. The second advantage is in pulmonary diseases, it is almost the main route of drug administration because in it is most effective and less harmful. The third advantage is first-pass metabolism is avoided in this route of drug administration. Now let's see some of its disadvantages. So the first disadvantage is some of the irritant gases can cause pulmonary secretions, and the main disadvantage is it is the most common route for some of the drug abuse. So now let's discuss some of the drug and equipments which can be administered by the route of drug administration. So in first one is this nasal drops. Many of the companies develop the nasal drops, but which I have is developed by company Nasopil, and it contains a xylometazoline. It is mostly used for 12 years or above, and what it helps for? It helps for mucosal decondensation and relieves dryness and irritation. The second one which I have is this Vicks inhaler. It is developed by company Vicks, and the content of this inhaler are Pudina ke Phool, which comprises of 41.54%. Second content of it is camphor, which comprises of 41.54%, and the last content is wintergreen oil, which comprises of 12.27%. So now let's discuss about nebulizers. Air or oxygen is passed through a solution and it produces a fine mist, which is inhaled by a patient while wearing a mask. Now let's see its advantages. Delivering drug consequently, and it can be also used for high doses of delivering of the drugs. Now let's see its disadvantages. The disadvantage is it is much expensive and the patient requires to wear a mask to use it, which will be not comfortable for all the patients. Now let's discuss some of the main inhalers. So the first one is pressurized meter dose inhaler, in which in which drug is suspended in a prevalent, which is given to the patient in the form of a dry powder, mist or a spray, and it is inhaled by the patient when the inhaler is activated. The advantages of it are it's inexpensive, it's convenient to use, and it is portable. And the disadvantage is not all the medications can be given by using this inhaler. So now let's see drug powder inhalers. This type of inhalers is mostly used by the asthma patients. These inhalers are also known as breath activated inhalers, which delivers a dry powder to the lungs. The dry powder which is delivered to the lungs are in form of corticosteroids. So mainly the which corticosteroids are used are fluticasone, budesonide, and mometasone. So now let's discuss some of its advantages. It is convenient and portable, and now let's see its disadvantages. So disadvantages is the patients need to breathe in deeply to activate the inhalers. So now let's see some of the drugs which can be administered via using nebulizers, dry powder inhalers, and meter dose inhalers. So the drugs are glucocorticoids, chromones, mannitol, then chromones, mannitol, glucocorticoids, hormonal vasodilators, and etc.
Thank you all for listening me.